Good afternoon, students. Today I'll see about the special test for the lower limb, hip, knee, and ankle and foot as a joint integrity on pathology. The special test how to use for the physiotherapy field is most important for the patient diagnostic procedure. This in the doctor you will see about any the criteria for MRI scan, CT scan report. How the physiotherapy role is the only one and tool is hands-on tool is a special test. The special test is must used for the how to diagnose the how the condition of the disease of the patients. Okay, that's important for specialist. Then first one is a FABA test is also called as Patrick test. Purpose of this test for to identify hip or sacroiliac joint pathology. This is mainly for if pain is elicited on the ipsilateral anteriorly of the hip joint, this is on the same side. Okay, if pain is elicited on the contralateral posteriorly, this is called sacroiliac joint disorder. Then the sensitivity of this test is the predicting response from sacroiliac injection is 57% and almost 100% specific. So this is the mainly for. Then FADA is the flexion, adduction and interrotation test. The purpose of the test is to direct femoroacetabular impeachment confirmatory test for this test. Then Thomas test is mainly for to assess the hip flexion contracture. That is for iliopsoas muscle contracture. Mainly for the Thompson test mainly for the edge of the table. Prone lying patient is edge of the table. Ankle hang for the out of the table. Is doing the plantar flexion is pain arise from the calf region. Is positive for tendon-based injuries. Then Trendelenburg test purpose for to assess the weakness of gluteus medius or hip abductor muscle dysfunction. Okay. Then Ober's test is mainly for to check the iliotibial band tightness. There is a iliotibial band tightness. Then Latchman test to assess the anterior cruciate ligament integrity test. Anterior test also to evaluate the anterior cruciate ligament injury. Posterior tower test to assess the posterior cruciate ligament injury. Is in this test anterior cruciate ligament is for supine lying. Is a patient is both hand is palmar aspect, thumb is placed on the tibial tubercle and the four fingers on the behind the popliteal fossa. Okay, his forces are the anterior transitive forces given the knee joint. Excessive transitive changes occurs to the ligament, anterior cruciate ligament. It's a positive for ligament injury. In the posterior tower test, mainly for the same line keep on the both thumb and tibial tuberosity, both four fingers of the popliteal fossa region. There is the opposite direction. Posterior direction is applied to the pressure. The posterior cruciate ligament is the excessive bleeding on the posterior direction. That is a positive for the posterior ligament injury. Then McMurray test to assess the meniscal tear. The mainly for the hip flexion is the hip flexion 90 degree, knee flexion 90 degree. The patient rotate the internal rotation. Pain on the lateral side is a lateral meniscal. Pain on the in the external rotation. Pain on the middle knee joint. That is a middle meniscal injury. Then Apley's compression test and distraction test to differentiate between the meniscal and ligamental lesion. Patient lying on the prone lying, the therapist would keep on the thighs supporting structure. Then patient is the lift the ankle, then distract and middle rotate of the ankle and is placed on the middle side pain. It's a middle meniscal. The lateral rotate of the ankle, pain on the lateral meniscal is a lateral ligament injury. Is a distraction test with the ligament injury. The compression test is a compression grading test mainly for meniscal injury, middle lateral meniscal injury. Then valgus and vas test also middle lateral ligament instability. Then patellar application test to assess the patellar instability. Then Thompson test also the tendon rupture. To posterior test also the, to assess the integrity of posterotalofibular instability. Ankle joint test. Anterior test for ankle to assess the anterior talofibular ligament integrity. Windlass test to assess the plantar fascia integrity. Then Homan sign is for to screen for deep vein thrombosis. The patient is to dorsiflexion. The pain region, the soft dorsiflexion of the foot with the knee extended with the dorsiflexion of the foot with the knee extension cause pain in the calves resulting from tension of the soleus and gastrocnemius muscle. The events of the calf vein thrombosis. Figure 4 test is mainly for to direct hip joint dysfunctions. So summary, the lower limb special test for the differential diagnosis is a very evidence-based physiological assessment tool for the special test. Okay. Thank you.